Myself, Saurav Sandilya. I am I'm in charge of academics and strategy at My Rehab Academy. Today's event about the importance of importance of research in the area of physiotherapy. Before we start, I'll introduce about My Rehab Academy. My Rehab Academy is a platform where we connect aspiring physios, fresh graduates, as well as working professionals in physiotherapy with the best of instructors across the globe for upgradation of their skills. My Rehab Academy has been conducting its courses since quite a number of months and have been successfully conducting its digital courses ever since the corona pandemic has hit our country. In this corona pandemic, where everything was getting slowed down, we decided not to stay at home, and then we decided to continue our education program for the society. We have successfully delivered more than 550 hours till date educational program in the corona pandemic itself. The moment corona pandemic start getting slowing down and we are allowed to do our physical events, we are coming up with a lot more physical events with lot more, I can say, the well-known names in the physiotherapy for our physical conferences as well as the workshop. Our upcoming workshop is very easy to see. You can just type message MRA and you can send to our number 9066990059, and you can get not only the information of all the upcoming events, you can get registered on that. You can actually ask for the certificates, everything. One number is the solution. That's how we have made our process very, very easy. Seeing our process and seeing our viral things over the social media, we got one of the best business awards in rehabilitation education field this year by one of the leading agency called Brandvotes. Very soon you will be seeing us in many of the journals. They are going to publish about our beautiful work we have done it.
Please unmute. Please unmute yourself. Dr. Saurav, please unmute.
Hello.
Yeah. Please go ahead.
Today's the importance of research in physiotherapy, we are having two well-known names as a speaker. I would introduce Dr. Arunachalam Ramachandran, who is the principal in College of Physiotherapy in Madhav University, Rajasthan. His credentials are quite long. He is editor of one of the journals from Netherlands, and recently he has started his giving his well thought editing point in one of the journal from the USA too. He is chief of Sairam Educational Institutions. He is chief of Sairam Sairam Clinical Specialty in Chennai. He is well-known name in Diabetic Fellowship Program for Physiotherapists, which he has successfully done with us, and many of us are quite happy seeing him giving lot more inputs about diabetes, which personally, being in the field for 15 years, most of us has not known. And his research, his education, and his service to the society is something which we must admire. And 2 days before he had birthday, I wish him belated happy birthday. And sir, it's all yours. And I would introduce Dr. Mohammad Sidiq. Once Dr. Arunachalam sir, he finished his things, he's going to talk about the research from A to Z, and the most importantly, how to publish your articles, how to choose your things, the best of journals to publish your articles. Sir, it's all yours. Kindly continue.
Thank you, Dr. Saurabh. Thank you, Dr. Divakar and Dr. Kalimullah and the CEO, Dr. Um, I take this opportunity to thank My Rehab Academy and ICRA, because we are coming together in this platform. Both I am part of ICRA as well as part of My Rehab Academy. And I'm so happy that like-minded people and energetic people are together on a single platform. So it is happy homecoming for me always when I present here. So during this COVID has taught us many things. Every time people say you have a webinar, many people are taken back and they say once again a webinar, and they are what to say? They sarcastically say that again webinar, everywhere webinar. But I always feel that if you are attending webinar, you should attend for the sake of knowledge, not for the sake of certificates. If you are attending for the sake of certificates, you will get bored up and you will not be happy in attending such webinars. So it's all about knowledge sharing. That is very important. Thank you so much, guys. So now we are going to see a very important topic, which is how to publish a journal. Before 10 years, if you ask anybody, any physiotherapist, except very few, if you ask how much is your publication, they will say, I don't have a publication. Because this trend of publication has come only in last 5 to 6 years, and it has peaked up only in this last 2 years. Why are we publishing more articles? To get a job in a hospital, in a college or university, to get promotion, to satisfy our employers. All these things are apart. That is how it started. I started publishing articles only to satisfy my employer, only to complete my PhD. But later on, I came to know that publication is all about reputation of a researcher. The most common question that is asked in case of publishing an article is, in which journal I have to publish? Okay, in which journal I have to publish? Before asking this question, I will tell you why you should publish. First of all, you should know this thing. So it is not to satisfy someone, or it is not to put your name right on top of your college or anything else. You should publish only for your personal development. So now if you ask me who is a good researcher, who is a good teacher, who is a good clinician, what normally we say? We say that a person who has good knowledge, who presents well, who has seen a lot of cases, who is successful as a best professional. But hereafter, a person who is having more publication will be considered as a good professional. And publication of good standards and good reputation is a good professional. So there is a good personal development for that. And international demands are there. So if a university is going to be right on top of the list, the faculty in that university should have published more amount of research. If the field of physiotherapy as such have to develop, you need a lot of research in the field of physiotherapy, and all these researchers should be published. So what happens nowadays? The poor researchers are being published in poor journals. So we are not getting good exposure. Indian physiotherapists or Indian researchers are not globally known because we are not publishing in the right platform. We are publishing in biomedicine, we are publishing in engineering journals, we are publishing in social journals, and we are not publishing in good journals. We are publishing mostly in the predatory journal. You cannot blame the physiotherapist for that. You cannot blame the IAP for that. We have to blame the UGC for that. UGC so far did not give a proper guideline. Now only they have given a proper guideline by means of a care list of journals to publish. Until then, there was no guidelines, so we were misleaded all these days. And this is very important, the research communication. A person sitting in Madras and doing some research, he has come out with a very significant solution for pain. How he will tell this thing to the fellow colleagues? Why he has to tell? First of all, because this is to be utilized by the field of physiotherapy and it should benefit the patients. Am I right or not? So then only your invention has some value. So how you are going to communicate this thing to the other professional all around the world? That is by means of publication. You have to go for a publication. And particularly the journal is a vehicle which is going to take your research to all the parts of the world. That is so simple. It's just a vehicle. You have to select the correct vehicle. That is very important. And this publications will also strengthen and improve your theoretical knowledge as well as practical skills, and improve your clinical skills. If you are going to publish more and it is being communicated worldwide, the assessment and treatment skills are going to improve. So that is very simple. Why should I select the correct journal? Next question. First, why should I publish? Second is, why should I select the correct journal? I will answer this that if you see in abroad, people who are working on multiple sclerosis will not look into all the journals for their evidence. They will select only 2 or 3 journals which are specific to multiple sclerosis, and they will follow that. But that's not practiced in India, but in abroad they do that. So if you want to reach that particular community who are doing research on multiple sclerosis, you have to select that particular journal which is publishing on multiple sclerosis. If you want to reach out to physiotherapists alone in the worldwide, you have to publish in journals like Archives of Physical Medicine and Rehabilitation, or Physiotherapy Journal, or International Australian Journal of Physiotherapy. Like those reputed journals you have to publish. So because you want to reach to the community, you have to communicate, you have a good communication with that particular community. Next is research association. On seeing your research, a person from New York will call you and he will say, I'm interested in your research, whatever you are doing. Can you tell me more about your research? In the next research, I would like to take part. Or I am doing a research similar to yourself. Can we have a tie-up? That is called as research association. I had got a research association from a Sri Lankan university, and also from a university from Norway, where a person who was doing a research on trunk in stroke patients messaged me through mail, and we got together very well, and the research is going on. So these two things are materialized, and from Sri Lanka, one scholar messaged me, and now I'm guiding him for the research in his Sir John Kotlawala University in Sri Lanka. So these are all possible only when we publish our articles worldwide. They will come to know that there is a researcher in this part of India who is doing work on particular things. Fine. So next thing is, reach out to a specific population. For example, for whom you are doing the study, you are doing for patients with pain, for low back pain, for instance. So these low back pain patients should read this. So you can reach to the people only when you publish in the proper journal. And improve your citation. So whenever, what is meant by citation? Whenever your articles are referred by some other person, that is quoted by some other person in his research as a reference, then you will get a single point of citation. That is how many times you have been referred. If you have 5 publications and you have been cited 10 times, then 10 divided by 5 gives 2. Your H index is 2. You have published 5 articles and it is being cited 10 times. Okay, so that is a thing. But nowadays, if you see, many people have lot of publications, hundreds of publications are there, but they are how often they are cited? They are cited only 4 or 5 times or 10 times maximum. And what happens? The numerator is less and denominator is more. So what happens? The H index falls less than 1, and that is a very poor researcher's identity. So what you have to do is, you have to publish 1 or 2 articles in a year, which is very valuable, and that gives more insight to others so that they will quote your research. So this is all about thing. So now asking you a question, where you want to publish. Journals are indexed by many indexing bodies. Okay, the first and foremost is a Thomson Reuters or Clarivate analysis. This one we call, those days they are called as Thomson Reuters. Now they are called as Clarivate analysis. They are also interchangeably called as Science Citation Index, SCI. So this is the topmost indexing body. If a journal is indexed with Thomson Reuters or Science Citation Index, then these journals are highest quality. Next comes your Scopus Indexed Journal. They are also of high quality. This is published by Elsevier series. You might be knowing a lot of books are there in Elsevier. So they are the indexing body here. Okay. Yes, Saurav has raised his hand. Any doubts? Saurav sir?
No, no, sir.
Not me, sir.
Yeah.
Somebody else.
Yeah.
I would request participant not to come in between the flow of our speaker.
No,
You will be given time, so kindly ask your doubts that time.
yeah, yeah.
So
No,
yeah, I
always
would lower the hand. Thank you.
fine. So if you see the science citation index, then Scopus, these two are the most valuable indexing bodies. What is meant by indexing body? If you are having a journal of your own and the journal is performing consistently well for 3 years, you can apply to these agencies to give their indexing. That is like an ISI or an AGMARK, which is kept on the food items to show that they are high quality. Okay, so Thomson Reuters and Scopus you should know. So apart from that, there are lots of their DOAJ is there, Google Scholar is there, and many things are there. If it is a condition specific indexing bodies are there. For example, in case of stroke community of Australia, stroke community of UK, all these things are also there. They are also indexing bodies, but the most important indexing body is the Thomson Reuters, Scopus, and next is our PubMed. Okay, if only the article is most of the Thomson Reuters indexed journals are indexed in PubMed, so you can easily say. So then only if you go, most of the researchers in worldwide, they search in PubMed. Okay, when they are searching in PubMed, if your article is indexed in any of these three types, then only your article will come up in PubMed and people will refer your article. Otherwise, very rarely people search in Google Scholar and all. Okay, so remember these things. Thomson Reuters, Scopus, and PubMed indexed journals are always good journals. Fine. You have one more tricky fellow. He is called as the emerging source citation. That is, this is also Web of Science and Science Citation Index, Thomson Reuters. I told you Clarivate analysis, but this is very substandard. It's emerging. Once you apply for this indexing body, they will give you something called as emerging sources citation. But this doesn't mean that it is there associated with the Web of Science. It is just going to be indexed, or it may. So this ESC is not considered as indexed with Thomson Reuters. You have to remember that most of the journals physiotherapists fail, or they are being cheated by this emerging sources citation. They say it is indexed with Web of Science, but it is not indexed with Web of Science. Be careful with that. And also don't believe on journals which are sending you email saying that our journal is good, we can publish here. You have been shortlisted in for publishing in our journal because you have done a tremendous work in the field of physiotherapy, but you know what work we have done. So don't trust on all these people, because it is all money making. It is money making to the core. So if you publish 5,000 rupees, you give them, they will publish your article. So don't believe in them. And whoever says that fast tracking, I will fast track your article within matter of 1 week or 5 days, 6 days, I'll publish your journal article, means they are also substandard journals. Please don't waste your source into these journals. Okay, what are the points you have to consider before selecting a journal? What is the field of study? The journal, what is the journal dealing with, whether it is concerned with physiotherapy or not. Being a physiotherapist, you should select any article that is related to physiotherapy. Or if you are a super specialized person doing some article on pediatric population, you can also select pediatric rehabilitation journals. Or if you are into stroke, you can select stroke journals. Or if you have done specifically on gait, you can go to gait and posture journal. Those specific journals, you have to see what is the field of the study. Don't publish in other medical sciences, biosciences, all these things, simply because they are offering you at low price. So your article is going to go nowhere. Next is the aim, objective of the study, objective of the journal and the study have to align with each other. Every journal, if you go into their website, they will be giving the scope of the journal. What I want, what the journal wants to publish, that will be given in the scope. The same scope combines with your alignment of your aim and objective, then only he will accept, otherwise he will reject your article. What type of research the journal publishes, whether it publishes RCTs, systematic reviews, or case studies. Certain journals will not publish case studies. Not all journals will publish case studies. Not all journals will publish systematic reviews. There are journals which are specific for systematic reviews, like reviews of neuro rehabilitation. They publish only review articles. They won't publish any of your RCTs or case studies. So if you have done review, you can publish there. You have a lot of scope. Out of all the 10 articles in a issue, every 10 10 article will be a systematic review. So you can go into that particular things. You have to see whether it's an open access or a subscription based journal. Here there is a very important thing you have to know, because the moment we suggest an article to a person, the next question he asks is how much we have to pay for the journal. It's a very tricky question. This open access means when you publish your article, it is given to entire world free of cost. That is called as open access. Your article everybody can read worldwide. So what is the advantage of this open access? Whatever you are publishing, whatever you are writing in your article, everybody in this world can read this. So you are taken to every nook and corner of the world and delivered. Your ideas are delivered free of cost for them. For whom? Who are downloading your article. But how the journal will be benefited? They will collect money from the researcher. The researcher who is publishing have to pay the money. In standard journals, the cost ranges from $1,000 to $4,000 to $5,000 also. Because in abroad, if you see, most of the physiotherapy researchers are funded. So they don't mind publishing their funded journals, and the funding body will give them the fund. But the pathetic scenario in India is we don't have any funding agencies to, even universities do not give money for publishing. So that is the situation here. So what you have to select, you have to select a subscription based journal. That means you can publish your article, only the abstract will be seen by the world. If they want the full text article, they have to pay money and they have to download full text article. Here the author need not pay anything. When you say paying, there are two types of payment. One is article processing charge, APC. For processing your article and publishing it, that is APC. And the second thing is for page charges. How many pages you have got? If you got 8 pages, the journal will give you only 6 pages free of cost, and remaining 2 pages you have to pay, or color pages you have to pay. So all these things are there. So subscription based journal will give you article processing fee free. So you can freely publish. But the person who is downloading your article should pay for it. So that is called as open access and subscription access. In open access, you have two types: green open access and golden open access. Golden open access means it will be free from the years to come. But if it's a green open access, then initial 1 year will be subscription based, and remaining will be, after 1 year, it will become open access to everyone. Anybody can see that. First 1 year, if somebody want to download it, they have to pay. Like that, a lot of varieties are there. So what you have to select, if you are if your article is a funded article, then you can go for open access. Very easily you can publish. Or if yours is not an funded, if you are not able to spend more money, then you can go with subscription based. Next is the impact factor. Any journal with more than 1 or 2 impact factor is very tough for Indian standards to qualify. So you keep your impact factor less than 1 or possibly less than 2, not more than 2. So that you have to see. If an article is having, if a journal is having 7, 8 impact factor, then it is very difficult for Indian standards to publish. So that is very important. Keep the impact factor low, and then see what are the indexing bodies. If you are very happy with any indexing body, you can publish, but your article will not reach anywhere. If you want Scopus indexed, then you find whether the Scopus indexing is there or not, and publish. Mostly Web of Science is very difficult to publish. Scopus is somewhat reasonably easier, and in PubMed you can identify some journals which are very easily published. So you have to keep researching on that. Next is your article compatible with the journal requirement? Your body of the article, your structure of the article, the abstract, the number of words, and all these things, whether the journal, you have the same format of the journal or not. Otherwise, they will reject it in the technical scenario itself. The technical team itself will reject yours. It will not go to the review side. Next is the frequency of publication. Normally, journals which publishes more than 6 times in a year are called as rapidly publishing journals. So these journals can have more number of articles in a year, and there is every possibility of yours getting published very soon. Next is the volume of the articles. A volume of articles means per annum how many articles they are being published. A journal will have 24 issues in a year, but every issue will have only 3 or 4 articles. So if you keep 4 articles, 24 into 4 will be somewhere around 96 articles per year. That is the volume of the thing. But there are some journals which publishes only 4 times in a year, but every issue they will have around 50 articles. So 4 into 50 becomes 200. So that also you have to see how many issues are published in a year and how many articles per annum this journal is publishing. If it is high, then that's well and good, you can go with that. Next is whether it is rapidly publishing or not. There are some journals which don't publish regularly in a year. Whenever you present an article to them, within a matter of 3 or 4 months they will publish. Some journals are there which publishes within 2 weeks. So journals which are publishing within 2 to 3 weeks of article processing time, they are called as rapidly publishing again. For example, the article processing time, that review processing time, if it is more than 6 months, it is very tough for you to wait for 6 months. So try to find out articles which have very less article processing time. Okay. Next is the acceptance rate. Any acceptance rate above 20-25 is a good acceptance rate. You can look into this journal acceptance rate. If it is more than 25, that means he is rejecting one article out of selecting one article out of 4. And if you have a good belief on your article, you can publish, because on an average the acceptance rate is less than 10 for most of the reputed journals. So if you have more than 25, there is a fair amount of chances of your article getting accepted. So what is the type of reviewing they do, single blinded or double blinded? I always prefer double blinded, because the author also doesn't know who is evaluating your article, and the person who's evaluating article also doesn't know from which country the article has come from, because most of the people, when they see Indian based article, they take us for granted. They tend to reject most of the time. They'll find native English is not there, that they will give you a lot of unwanted claims. If you see Elsevier, the Scopus indexed journals, nowadays there are a lot of dispute in Elsevier saying that the Elsevier rejects articles without any reason. No reason, because the load of articles is such that the people are not able to screen these articles. They just like that reject it. When they see India, they will reject. So double blinded means your article will not be seen by the examiner who's evaluating. Your reviewer will not be able to see whether it is from India or any other country. So double blinded is always good, but most of them are single blinded journals only, review processing. Next is average review time, that is time for the first decision to take. This is more or less like the acceptance rate, so I don't want to confuse with that. And there is something called as competitiveness. The competitiveness, if it is easy, then your article will be easily accepted. If it is moderate, it will be slightly tough. And if it is strong, then please don't go to this journal, because they will have repeated rounds. They will not be compromising themselves. For example, in a place where you have to use a square bracket, if you have used a curved bracket, they will send the article back to you saying that put the square bracket there. So that means that is this very silly thing. We will think, why don't he do that for us? But he will not do that for you. He will send for each and everything. He will send it back to you, and they will take more time for publishing. So competitiveness, if it is very strong, please don't go to that. If it is easy, then you can easily apply on this. So I am finishing my theoretical presentation here, and I'm going to my practical presentation. If you have any doubts, you can stop me here.
Sir, there are few participants want to ask you question.
Yes,
They can unmute. They can
Yeah.
unmute.
Question is from Abhishek Sharma. Want to know what is Q1, Q2, Q3 category journals?
Okay. Q1, Q2, Q3, Q4 are quality journals where the journals based upon their impact factor and competitiveness are categorized into 4 categories. But for an Indian standards, we always have to publish first in Q1 listed journals because they are a little easier than Q3, Q2, Q1. Q1 is the highly toughest list of journals. Please don't prefer that. If you are an amateur person, go to Q4 listed journals, and that itself is going to give you your money worth a run for that publishing. So it's a quality which is hierarchically arranged for Science Citation Index. You also have the same hierarchy in the care listed journals of UGC. Fine.
Okay. The question from Sajjan Pal is like, please update the free journal name so I can choose directly. Also, this time many journals are not in Scopus or Wave of Science. How can I select the right journal for publication? So,
that was all I was telling all this time.
yeah.
Don't
Yes.
go and ask anybody, tell me a name of a journal. That is the one mistake what we do. Because what article I have in my hand, I don't know. Based upon my article only, I have to select a journal. X or Y might have published a journal on low back pain, but I might have done on a stroke. I cannot go and ask him, what is your journal name? I want to publish there. It is inappropriate. That shift in the habit should happen in the field of physiotherapy, where you should specifically select your journals to which it is appropriate. Otherwise, your information is going to be stagnant. It is going to be kept in the storeroom. No use.
Okay.
Okay, so select, you
Okay.
sit in the internet and you select. That's what I'm going to teach you now. See, I have selected a journal called Gait and Posture. Okay, so this is my article. I am an journal selection assistant at Enago. Okay, so I have got a article. The title of the article is Change in Foot Center of Pressure Trajectory at Different Walking Speed in Healthy Adults. This is the title. Change in foot center of pressure trajectory at different walking speed in healthy adult. How the foot pressure changes when the patient is walking in different speeds. Okay, this is my article. So what I'm going to do is I'm going to select an article for that. So I have selected this journal for that. This is Gait and Posture. Why I have selected this journal? If you see this journal's aim and scope here, Gait and Posture is more of publishing about gait cycle studies and normal and pathological gaits. So here he says that the study is publishing on normal people also. So my study is also on normal person. So I am trying to find out how the pressure gradients varies in gait. So I am going with this journal. So once I go into this journal, I'll see their ISSN number. This ISSN number says that it's a standard journal. It gives the impact factor also. Okay, impact factor 2.349. But I consider my journal, my article to be good quality, so I don't mind 2.34. Then I come down. I see here. Okay, so I am going to see in what areas it is being abstracted. So abstraction is very important. Abstracting means you will see it is indexed with PubMed and Medline. Okay, it is indexed with PubMed and Medline. It is indexed with Scopus. So these two things are good source. So I am going to go with this journal because this journal is a standard journal. I come to know that this is a very standard journal. I go to the guide for the authors. In this guide for the author, I can see what are the guidelines given for the author. You have to go through all these things, then only you will know. See, always this is an Elsevier publication. So all Elsevier publication, your journal searching is very easier. You see all these things you need will be available here, whether it is an open access or an subscription based journal. Even if it is an open access, if you go into that, okay, he will give you an option whether it is an you can publish as subscription based or open access. Okay, you have to go to the open access page. It will give you the information, and author has to when applying itself, he has to say I would like to publish this in a subscription based manner because mine is a non-funded one. Okay, And if you want to see how many issues are being published by this journal, you have to go to view articles. And once you go to view articles, you will have archives of the articles there. Okay, see, you have got the archives of the article, and you can see all issues. And if you click on to all issues, every issue published in this journal will be seen. Okay, you can see in 2019 how many articles are published, how many issues are given. You see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 issues are being published. So that means this journal is publishing very frequently, and I would go with this particular journal. It's a very good journal. Okay, so if I want to know what are the recent publications, whether the foot pressure trajectory, what I have measured is being already published or not, then I have to go inside every volume and I have to see, or I can search here. I can search here as foot trajectory. If I search here, if I see foot pressure, anything about foot, yes, I have got a lot of articles on foot, related to foot. See, in this corner, if you see from 2018, 19 and 20, you have got more than 1,000 articles published on foot. So there is every possibility of your articles getting accepted is there. Okay, once you have surfed into this journal, you will get to know what are all the things. You can see the recent articles published, most cited articles published. If your article is also somewhat related to this, then your article will also be cited more. Okay, so this is how you have to select your journal. Very important thing is how often it is published, where it is indexed, and how sooner your article will be published. And you have to see whether in recent times articles like your article have been published in this journal or not. Otherwise, it is very tough. I will show you an recommendation I have given for this journal. Can you see my Word document?
Yes, sir. Please go ahead.
Yes, yes. So for this Word, change in foot center of pressure trajectory at different walking speed in healthy adults. The recommendation I have given to that author. The author had asked me, because I have to suggest an journal, 5 journals. I have the first one I have suggested is the posture, gait and posture, which is having this much amount of impact factor and is indexed with Elsevier. It's publishing 8 times in a year. Okay, is it a paid journal? Yes, it's a paid journal. So I have given a note here. The recommendation for this article was based on 3 major domains: biomechanics, physiotherapy, and foot. So if you see, I have also suggested Journal of Biomechanics, because the thing which are measured here, foot trajectory, is a biomechanical aspect. Journal of Electromyography and Kinesiology. Kinesiology is the science which deals with movement. So here they have assessed walking changes in the dynamics of walking. Clinical Biomechanics, Journal of Foot and Ankle Research. So these are the 5 most appropriate journals in which this particular article can be published, and out of this 3 are Q2 listed journals, because the author had asked me for a high quality journal of more than 1 impact factor, less than 3 impact factor. So I have suggested him all these 5 articles. In that, I have given these first 2 as highly recommended, okay, and the other 3 as moderately recommended. This is my job in Enago publication. Actually, I should not reveal this, but not a worry. If this is going to help my fellow professional, I am ready to take up that. So next is, every journal I would give a report like this. The journal name, what is the URL of the journal, the reason for choosing this journal, I will give. So here, a small example I'll see why I have selected this journal. I feel this article exactly suits the journal without any doubt, as the primary aim of the journal is to publish articles pertaining to measurement of gait patterns of normal subjects to form a normal value to gauge the abnormality or deviation in pathological gaits. So that is the aim. Moreover, this journal is a choice of the author too. The author also asked for this journal. The journal publishes articles from various countries with Japan, because that the person who has done this article was from Japan. You also have to see whether you are in that particular journal Indian articles are published or not. That gives a clear idea that the journal do not have any bias. Okay, so in this journal, Japan stands as a the sixth place of number of articles being published. It's published 8 times in a year with 2 supplements. Every year they are publishing 2 supplements also. That means they want to publish more. Okay, this journal is very reputed, and in the literature survey of similar topics, this particular journal stands tall, and heavy publication on gait analysis is being done here. So all these things are and I should see, is the paper compatible with the journal guidelines? Yes, the article which is given to me is compatible to this journal pattern. So what is the impact factor? What are the specific topics published in this journal? All these things I have to make a homework. And last but not least, I should see whether 2 articles are published in the recent times which are related to this article. I have found 2 articles: the effect of unstable shoe design on variability of gait measurements, which is somewhat similar to my study. The other study is influence of feet position on center of pressure measured in stroke patients, which is also similar to my study. So I can very well go with this particular journal. So this is how, my dear friends, you have to select your journal. You have to sit and search. Just like that, you cannot get journals for publication. And I would also suggest this particular website. Okay, can you see my screen now? My Google Chrome screen. Okay.
Yes, sir.
Yes, sir. Please go ahead.
Yeah. So for my people who are attending this program, this journal, this website would be very new for you. I think you are not familiar with this website. The system is quite slow. I'm sorry for that. In this website, I'll give you the link of this website in our chat box. So I have given the link in the chat box. You can go to this website. If you see this website, you have got a search box here. You can type any name. For example, you have done on pediatric physiotherapy. Okay, so you can first search for physiotherapy. Okay, now you have searched for physiotherapy. You have got some suggested journals here. You can click on to anything, Physiotherapy Canada. Okay, if you click on Physiotherapy Canada, then you have to click search. Once you search, so the article is published here. The impact factor is seen. Okay, what is the category? Most of the physiotherapy journals are into the medical category only. And see whether it is indexed. It is indexed with Science Citation Index. It is an open access journal. No, it is not an open access journal. It is a subscription based journal. So Physiotherapy Canada can publish your articles free of cost. They will charge from the person who is downloading it. Compatibility, I told you, competitiveness, easy. So easily you can publish. But you see the review period, it is more than 3 weeks. That's fine. Okay. It's an average period. If your article is good, it can be accepted less than 12 weeks also. So if you click onto this here, another page will open. You have to click onto this Physiotherapy Canada. The another page will open where it will show about the H index of the journal. This is also a very important index, because how many articles a journal is publishing in an issue and how many times those articles are being cited. So that is called as the H index of the journal. Okay, so every one article is being cited 22 times. That is the H index says. but you see the annual article volume, every year you are getting only 40 articles. So that is very less. So your article will be not qualified very easily. So this is a one negative in this. Otherwise, all are positive. And how often it publishes? It's quarterly. That means 4 times in a year. So you just take down this particular website. You can search everything in this website. If you are searching like related to exercise or related to diabetes, if you are seeing diabetes, okay. So if I search as diabetes, I'll get a lot of journals which are related to diabetes. I can grade them according to the impact factor. So if I click here, it will show the highest impact factor first, and then subsequently followed by the lowest impact factor. So I can travel down and I can go to maybe 1 or 2 impact factor, and I select journals which are published in diabetes. Fine. So that is the end of the presentation. Actually, I normally used to do this presentation for 1.5 hours to 2 hours, or even 3 hours. It will go selecting a journal for publication. But this time we are making it precisely for 40 minutes. So it's
Sir,
quite rapid, and you can ask your questions.
sir, there is a
Yeah.
question from Arun Balasubramaniam. Why Indian physios researchers find difficult in publishing in USA or Australian journals like APTA, APA, GAOSPT, JGA, etc.? Why do Indian physios find difficult?
The basic problem why our Indian journals articles are rejected is we don't have ethical clearance, first of all, sir. Ethical clearance is a must for most of the and second thing is the data is what we do, the manipulations what we do can easily be identified by softwares nowadays. What Indian physiotherapists do is they see 5 patients or 10 patients and multiply that into 30 patients, 40 patients. With the distribution, if the data distribution is analyzed, we can easily find out whether the data are manipulated or whether it is a normal phenomena. So they will reject your article there. Second thing is the language. If the language is not like a native English translation, if it is not done, most of the time these US people and UK people will reject your article. And the other important thing because of which yours is rejected is the methodological strength, how you have controlled the confounding way. If I say I'm giving management for pain and I'm seeing how the pain is behaving, we often fail to control the other factors that are influencing the pain recovery. So in case if the relationship between the dependent and the independent variables is not defined properly, and you have a lot of confounding variables on the outcome, the technical team most of the time sends it to the review and the reviewer rejects it. So that is a major problem with Indian research. We don't concentrate much on the technicality of writing. So we need to improve our writing. You have a lot of reporting formats like equator reporting formats, where you have international standards for reporting particular article. If your reporting format is also not sufficient, then your article will be considered as incomplete. Then they will reject it. It is not incomplete means doesn't mean that you don't have your discussion or your research part. It means that the information which are given about this hypothesis testing is insufficient. So that's what they will say as incomplete. So these are the major reasons why Indian articles are rejected on a international arena. Thank you, Arun sir.
Yeah. Kindly unmute yourself and ask questions. That will be also permitted. I think sir is taking your questions. So you can unmute yourself and ask question. I think Nikita has some question. So kindly.
Yeah. Please unmute. Please unmute yourself.
Hello, am I audible,
Anyone?
sir?
Yeah, you're audible, ma'am.
Good evening, sir.
Good evening.
Sir, I wanted to ask you that the important points which you told us to choose a journal for publishing the articles. So those points fall in which category of quality for the journal? Q1, Q2, Q3, or Q4?
Yeah, Q1, Q2, Q3, Q4 applies to the Web of Science journals only, indexed with Web of Science. The PubMed do not have Q1, Q2, Q3, Q4. Even in this place where I have shown you. Okay, just have a look at this. So when you go into this, you will have here the Q2. This is indexed with Q2. So if only your journal is indexed in Science Citation Index, you will have the Q1, Q2, Q3 quotient. If it is not indexed with Science Citation Index, there is no point of Q1, Q2, Q3, Q4. The UGC is adopting this Science Citation Index because it is the most standard indexing body. So we are also adopting that. That is why now PhD people, if you are doing PhD, if you are not publishing one journal in the care list journal, you are not going to complete your PhD. So publishing one article in care listed journal it's very tough nowadays. What we are all doing, all PhD scholars are doing is they are finding loopholes to publish their articles very easily. That scenario should change. You should become more competitive. People from Gujarat ask me which is the easiest journal to publish. Don't look into easiest journal to publish. Look into competitive journals where you can groom your knowledge. That is what I always tell my PhD scholars. So
Thank
Q1,
you.
Q2, Q3, Q4 is quality indexing in Science Citation Index.
Oh. Thank
Yeah.
you, sir. Thank you.
Thank you, man.
Yeah, next person.
Anyone else? Yeah,
Please,
Sapna, madam. Yes.
There is one question from Abhishek Sharma. Sir, Indian journals are difficult to find related to physiotherapy. There is not even a single journal which is published from India pertaining to physiotherapy, which is indexed with Science Citation Index. That is a very pathetic state. Yes, our journal standards, Indian journal standards are poor. It cannot be easily indexed. But you find a lot of Indian journals related to physiotherapy in Scopus and PubMed. One or two, not much in PubMed and Scopus.
yeah. Sapna, Dr. Sapna. Anyone else?
Okay. See, you have to open the journal and you have to go through all the journals. There are some good journals you can find by the publishers. The Thomson Reuters are good. The Elsevier are good. Jefferson and Taylor are good. Springer series are good. So you see, you also should know about the publishers who are standard publishers. Thank you, CEO Suman sir. Thank you, my dear friends, for
Yes,
this.
Thank you so much for the brilliant presentation, sir. I know this is a very vast topic, but you made it so lucid, and people kept listening it. They asked quite passionate questions. I know it's such a never-ending topic that like all the questions can't be finished in this kind of time span.
And
But it was a brilliant and an amazing presentation from your side.
thank you, dear. I was worried that Sidiq is going to consume my presentation. He is going to present fabulously, and he is going to consume my presentation.
Thank you so much, sir. Thanks a lot.
Thank you.
Very good evening.
Yeah, Yeah,
Can you
Sidiq
hear
sir.
me?
Yeah, you are joined. You are joined.
I'm joined. Yes.
Yeah,
Yes.
I welcome Dr. Mohammad Sidiq to explain about the professional prosperity. Yeah, sir. Yeah, he's starting in screen. Sir is a well-known research scholar, and the he's the person I can say that in India. One day he'll be known for bringing the research for physiotherapy. His credentials are too long. He is the member for editorial team for the MSK and back conditions journals from Netherlands. He is editorial person even for some of the US journals. He is also into he is a president founder of ICRA, I mean Indian Clinical Research Association. He's a research coordinator at NAAFH Kingdom of Saudi Arabia. He's advisor at Mandela United Kingdom, international peer reviewer of JB, MSK and SQUH Netherlands and Oman. Sir, I welcome you to present your topic, that is need for clinical research in professional prosperity.
Thank you so much. I hope that I'm audible to you all.
Yes, a little, you can increase your voice little bit.
Okay. Okay. Just a minute.
Just from your mic side, please. Yeah. And
yeah. Is it okay now?
And you, yeah, your and so your screen is having some of the black on top. Just see if it is. It's covering your logo.
Logo. Okay. Okay. Just a moment.
Yeah, please take your time.
Give me a second.
Yeah, please.
Is it okay now?
Yeah, sir,
is it okay?
Yeah, the black screen is moving around like the kind of grayish black on your presentation slide.
Okay, just a moment.
Yeah, you can just again start.
Okay, I'll stop it first. Okay.
Yeah, stop it and then start sharing. Yeah.
Okay, now fine. Now is it okay now?
It hasn't started yet.
Okay, just give me a second.
And share the screen.
Is it okay now?
It's coming. Let us see.
It's okay?
Yes, perfect.
Yes, sir. Perfect. Perfect, sir. Please go ahead.
I think it sir has to unmute.
Okay, can you all see me now? Yeah.
Yes, sir.
Okay. First of all, I would like to thank the whole team of MyRev Academy, including the CEO, Dr. Sumanji Sharma, the Saurav, Dr. Diwakar, and Dr. Kali Mullah Physio, and most importantly, Dr. Arunachalam sir, who was there, who had a brilliant presentation. So before I start my presentation, thank you so much for the wonderful introduction of mine. Before starting my talk, I want to ask you that this is a question from my side to all the listeners and the participants. How many of us in India are doing clinical research? For example, the data I got, I'll be sharing with you that why this topic is very important for your practice, for your future, and for your coming years of your career. It's very important. Now, beginning my talk, first of all, you should know what is clinical research. It's very important. I hope that I'm audible. Huh? My voice is clear?
Yes, sir. Yes, sir.
Okay. So, Clinical research is a branch of healthcare science that determines the safety and effectiveness of medication, devices, diagnostic products, and treatment regimes intended for human use. So whatever you are using for human use, whether it is effective or not, what are the safety standards, it is determined by clinical research. These may be used for prevention, treatment, diagnosis, or relieving symptoms of disease. Whatever technique you are using or anything you are using from the clinical side, that is determined by clinical research. Whether it is effective or not, that is most important aspect of clinical research. Now moving forwards, why do we need research? We need research because good research is about good science and good ethics. Without having a good research, you will not have good science, because science is the thing that which has evolved since many centuries. It has evolved, and that has led to the discoveries of many unknown facts, which has broken the myths, and it has given us a light, guiding light towards perfect healthcare phenomena, and which we call it practice guidelines. And good ethics is that when a clinician, he knows that this thing is good for the patient, this thing is bad for the patient, this is effective for the patient, this is not effective for the patient, that in that sense he becomes a good practitioner, because he is following something called as medical ethics. It's a very important part of our clinical practice. So when you are having a good research perspective, so you will be practicing good science and good ethics. Now there is something called as good evidence. Second point, what is good evidence? Good evidence, as you know, that evidence starts from case study and it goes to the meta-analysis in the pyramid hierarchy of evidences. So if you are having, if you are having good evidence, that it can go to the hierarchy of evidence, so that we understand what is the best possible evidence available with us, and it can help the healthcare practitioners around the world, around India, and anywhere in the past world. Now, why evidence-based healthcare is important in our clinical practice? Because better practice that is based on best evidence. When you have best evidence available with you, you will not have myths or assumptions. In physiotherapy field, I'm also since 21 years I'm in the field. What I have seen sometimes we still follow myths or assumptions. कि ऐसा होगा तो ऐसा होगा. If you see a patient, you try to imagine, अच्छा इसका back में ऐसे हो रहा है, it will be having this. No, this is assumptions. You have to back your data or assumptions with clinical data or with something evidence which is available for you. Now, last point is that it can lead to better health status. When you are practicing all these ethics points in clinical research, that will lead to best or better healthcare status in the society. That is what you are being part of. Now the important thing is that why it is important for physiotherapy professionals doing clinical research. It's very important thing that you should know. That is my center of the that is the main core of my talk. Evidence-based practice has increasingly being recognized as a priority by physiotherapists, influential researchers, and clinicians in the field, because they understood. We see, before I am also seeing India since 5-6 years, that the amount of practice we are practicing now, that is much more better when we are talking about the evidence-based practice. And you have to understand that evidence-based practice, it has been a priority right now for all the physical therapists, influential researchers, and clinicians in the field, that they want to give something best to the fraternity. Now, scientific output analysis of the current research productivity of physiotherapists will allow the construction of baseline indicators in this area of knowledge and professional practice. When you have some output analysis of scientific evidences, it will help us to make a baseline indicator that what is the required for the particular condition or for particular disease, and how we are going to approach a particular area or a condition, any condition, whether it is back pain, cervicalgia, knee problems, whatever condition you are talking about. So we have to have some kind of scientific output which is from the evidence-based practices that can help us to have knowledge, and it can elevate our professional practices. Now, for the physiotherapy professional uh, mature and mature in developing countries like India, we need more clinical relevant and patient-centered research. Now, this is a very important point. For physiotherapy profession to grow and mature in developing countries like India, we need clinically relevant and patient-centered research, not therapy-centered research. Now, what happens? आपके पास एक patient आता है, a patient comes to you with a kind of any musculoskeletal pain or any kind of pain हुआ था आपके पास, sir, I have this pain. Now, therapist should not have his own approach. नहीं मैं इसके लिए ये करूँगा, ये अच्छा इसके लिए रहेगा. No, if therapist has to have a kind of patient-centered approach, you should there are something called as patient rights and ethics. You have to respect the right of patient to there is something called as right to refusal of treatment and right to take treatment. So patient has equal right to ask you that whether he wants to take this treatment or not. So that a therapist has to understand that we should always focus on patient research, patient-centered research that will be having very good effect psychologically as well as physiologically on the patient health. Now, yeah, this is very important. I want to share with you. This is something called as promoting research in physiotherapy, value for profession and patient. It was developed for European guidelines. So I just wanted to understand that, show you that why it is important, because this is very important. Why you should understand that the purpose was the closing the gap between research and clinical practice by informing the individual physiotherapist about the importance of research and thereby on how to improve practice. So it was very important for us to promote research in physical therapy so that the value of profession and the patient increases. It's very important. Now, we want to close the gap between the research and clinical practice, but we have to inform the individual therapist about the importance of research. Now, there are something innovations, clinical practice, high quality physical research, and education. If therapist lacks any of these elements in research, he cannot be able to generate a good science, or he will not be able to follow clinical guidelines what evidence has given us. So physiotherapist has to be innovative, but that innovation, it should be supported by education and high quality research, and that will lead to high quality of clinical practice. It's very important. Now, reflections for any physiotherapist. What impact does research have on my clinical practice? Now, I'll tell you my own experiences. When I joined Ministry of Defense, I started working with them. That time I was only a specialist working for the ministry or for the soldiers. But when I had my research in my own career, and even many of you can ask Arunachalam sir or anyone who is in research since long time, it has given a very good impact on our career and our practice guidelines. Why? Because people want to understand, and your colleagues, they know that, no, if I talk to this kind of guy, he knows about evidence. They cannot tell us some fake reasons. See, if there is a neurosurgery consultant or there is an orthopedic consultant who has learned a brief about physical therapy before 10 years, now he cannot do the same in today's era. No, we have to tell him that, sir, this evidence is, if he tells you that you have to use exercises for low back pain, or you have to use TENS for chronic low back pain. Now we have the evidence, we can tell him that, sir, this thing is not acceptable because we are working in very different era. So that is only possible when a therapist has clinical research. Now, do I incorporate research finding evidence into my clinical practice? This is the question I'm asking you all. That how many of clinical therapists in India or anywhere are following these guidelines? That, okay, I got this particular condition. Am I using my evidence into this clinical practice? If so, how? How I'm using it? Am I doing any research with them or no? Or am I doing any? It is at least a case study will be helpful in this scenario. Now, is there a need for more research in my clinical area? Which clinical questions need to be answered? So this is very important question, that is there a need for more clinical research? If I am treating a patient of low back pain or cervicalgia, do I need some more evidence which is not available with me? So these are the questions which you need to be asking yourself. So we have to do our introspection, that am I on the verge of clinical research? Do I know what evidence is available with me? So it's very important कि आपको ये जानना पड़ेगा कि मेरे पास जो techniques हैं, जो methodology है, am I following the right pattern? क्या मैं right pattern follow कर रहा हूँ? वो आपको जानना पड़ेगा, because this is the very important aspect. Now, moving forwards. Yes. Now, why? Because evidence-based physiotherapy should drive clinical practice. It's very important because our EBP, it should drive our clinical practice. Research and evidence is crucial for an autonomous profession, because we are an autonomous profession. Now, you might be knowing that अभी 2 दिन पहले एक bill pass हुआ है राज्यसभा में, where the definition is very good. I like the definition of physiotherapy, जहाँ पर कहा गया है कि a physical therapist can practice independently or a part of multidisciplinary team. So this is a very good definition. After so much, इतने सालों बाद आई, तो I was very happy when Dr. Prabhat Ranjan told me that this definition has come. So you have to have research and evidence with you for an autonomous profession. क्योंकि जब आपके पास patient refer होके आएगा, you should be able to do clinical reasoning कि इस patient में क्या assessment करूँगा मैं, how we will treat this patient. It's very important. Now, I told you that there's something called as intra and interprofessional cooperation. It's very important. हम लोग जहाँ काम करते हैं Middle East में, यहाँ पर we are a team. There is जो orthopedic consultant है या neurosurgery है या psychiatry है, they will never interfere in my work because they know that I am practicing clinical research. So what we do, we work together, we make papers, we publish papers together. We have psychiatrists, general surgery consultants, orthopedic surgeons, neurosurgeons, and other people. So we have to have an intra and interprofessional cooperation. It's very important. You should never tell that a doctor सब अच्छा नहीं है, या he has no. Never breach your ethics. It's very important. Now, ethics, that is consent and legislation. It's very important that we should have consent from any of patient or anyone who's coming to you, and legislation, that is the वहाँ पर क्या कानून follow होता है, which is the law of land. You have to follow that regarding the clinical practice guidelines. Now, knowledge transfer. It's very important when you discuss your cases, your research with them. It is a kind of knowledge transfer. आप उनको बताते हो कि देखिए मेरे पास भी research है, I'm going to do this research, or I have done this research, so it's going to help us a lot in our clinical practice guidelines. Then consider clinical implication and focus on clinical implementation, guidelines and effective care. You have to understand that in clinical implications and implementation, इस condition में इस technique का क्या result निकलेगा on my clinical cases, you should know that, and the guidelines which is given by WCPT or anyone जो आपको govern कर रहा है India में. Patient value and quality of care. You should always respect the patient value. I told you in the beginning, there are some ethics of patient, the right to refusal of treatment, right to accept treatment. You have to respect patient's privacy, should not make his data public, should keep it confidential. So it's there are many clauses in ethics. That is the later part of the study. वो मेरा standard of नहीं है. Then quality of care, definitely the moment you are practicing all these things, the quality of care will improve. Health policies, European framework and social needs. ये उनके पास यूरोप में या मिडिल ईस्ट में they have the policies. किस therapist को लाइसेंस देना है, is he eligible for particular condition or disease for technique. So that is very important. That in India, right now we don't have any guideline. हाँ हमारे पास कोई guidelines नहीं है. Anybody can do any technique. यूज करेगा. उसको nobody is going to ask him that where from you learn this technique. Is this technique valid है क्या? आपने इस पर कितनी research किया है? So nobody is asking that. So that is the important why we did clinical research and guidelines from the health authorities. Now innovations. There are some techniques जो आप market में ला सकते हो, but you should have the evidence-based practice. आपको उसमें backing होना चाहिए. Now, how a therapist can do that? Every physiotherapist has a responsibility to keep updated on research findings in their field and use valid and reliable objective outcomes measures and patient related outcome measures. उसको ये होना चाहिए कि you should know that what is my outcome, मैं क्या use कर रहा हूँ, whether I'm using a scale or questionnaire, whether it is valid or not, और patient outcome पे क्या पड़ रहा है. Understood? It's very important that every physio has to know. Every physiotherapist should be aware of the importance of research for the development of profession, clinical practice, and increased patient value. It's very important that you should be aware कि मुझे इससे क्या मिलेगा. It's very important. Then you can develop your profession and your clinical practice. Every physio should implement research findings and, when possible, inform or facilitate research efforts and priorities, and contribute to the expansion of physiotherapy horizons. It's very important. ये हमारे पर एक कर्ज है from the fraternity that every time we should implement research findings. कि हाँ अब ये findings आई हैं किसी चीज में, how we should implement that in our surroundings, in our colleagues, in our friends. कि आप ये जो कर रहे हो ये गलत कर रहे हो, हमारे पास नया evidence है, please use this and you should give it data. It's your responsibility to help each other. It's very important. Now, physiotherapists may generate new ideas from clinical experience and observations that can be transformed into new knowledge and eventually may become evidence-based practice. There is something called as one is evidence-based practice. Something secondly is called as experience-based practice. Why it comes जब आप कोई चीज को काम करते हो and you feel that ये टेक्निक से मुझे मेरे पेशेंट को बहुत फायदा हो रहा है and I feel that this technique is much helpful than this technique. So you can generate your evidence. You can tell me that sir मैंने particular technique use किया, I did Mulligan मैंने glide किया, मैंने grade 3 मुझे इसमें effect आया ज़्यादा rather than other technique. So you can develop that question into a research question and publish that so that you are giving something new ideas to clinical practice. That's very important part of this research. Then a physiotherapist should be able to rely on the support of their national member organization, striving to engage all physios in quality assurance and research matters and to implement new research findings. Now, in India, as you know that we have mother body IAP, अब वो कितना काम करती है that you all know, but it is their duty to engage all physios so that if there is some research coming, they should be implemented and they should facilitate that. उसमें अगर वो कुछ grant आपको देंगे या they will help you in anywhere possibility, it's their job. They should do that. Now, a physiotherapist should research dissemination of journals, conference and media. ये हमारे बहुत important है कि a therapist when you are doing some clinical practice आपको आपने research किया, it should be told at mass things so that people understand कि हमने क्या काम किया है and why it is important. So it is very important that we should go to conferences and journals and media so that they understand कि इस technique में क्या चीज है. I will show you in the later part of slides. क्यों मैं ऐसे बोल रहा हूँ आपको. Now, okay. Now this is the clinical research scenario in India. I will just tell you. Yeah, there's a study which was done by K. Hariom et al. In 2014. It was done. It shows trend in the number of papers published by Indian physios. अब देखो 2004 से जो trend है till 2004 there was no much research published. And आप देखिए this is the number of researchers and this is a year of publication. Now you see there is an upward trend since 2014 and then I didn't get data. अब मुझे चाहिए data. If I need data, then how many papers have been published by Indian physios? वो data हमारे पास availably मुझे नहीं मिल रहा है because that is very important that I want to have that data with me. Now, yeah. So, what are the 5 steps of evidence-based practice, which is to be used as follows? Now, ask formulation of research question. You know that patient intervention and outcome measures or format. It should be followed by all therapists. It's very important that to follow for evidence-based practice. Acquire knowledge of search engines, database and literature research. ये आप करना पड़ेगा because if you want to understand the technique, if the K-tape is effective in low back pain or tense, आपको ये करना पड़ेगा. You should have knowledge of how to surf research engines. There is important topics है. Arunachalam sir is very good in that how to select particular engines or search engines. PubMed है, Snahil है या whatever Cochrane websites है, whatever databases. You understand that literature search is very important कि इससे आपको पता चलता है कि इस टेक्निक में कितने पेपर पब्लिश हुए हैं, are they effective or not effective. Then appraise, inclusion of levels of hierarchy of evidences, types of study design, types of validity and reliability, tools of critical appraisal, and inclusion of statistical methods. Now appraisal में क्या होता है, हम क्या करते हैं कि अगर हमारे पास कोई आर्टिकल पब्लिश हो चुका है, उसको हम देखते हैं कि क्या ये इफेक्टिव, कितना इसमें पेपर क्वालिटी कितनी इसकी थी, whether they used proper designs of studies, और इस कितनी reliable इसमें reliability validity थी. So all these things are important when you are going to start your research career. Now, fourth is application of evidence in clinical decision making. So this, when you are aware that ये चीजें मैंने कर दी हैं, now you can apply this evidence based practice in your clinical decision making, जिससे आपकी प्रैक्टिस को बहुत ही फायदा मिलेगा, and you will understand that it's very important part of your research career. And last is the assessment, that is ability to self reflect on how well the previous 4 steps were performed. अगर आपने ये चारों चीजें किया in your clinical practice, so you will be able to assess that whether I am going in the right direction or not. The to introspection, because it's all research is all introspection, कि मैं सही कर रहा हूँ, गलत कर रहा हूँ. Now, this is the few examples of treatment based on myths and evidence in India. अब आप देखो इंडिया में कुछ कंडीशंस हैं, आपको बताऊंगा मैं ये कुछ इंडिया में कितनी टेक्निक्स यूज होती है. दिस इज वन, ये पेपर एक पब्लिश हुआ था, फिजियोथेरेपी मैनेजमेंट ऑफ लो बैक पेन इन इंडिया, नफीसा एट ऑल ने पब्लिश किया था इन 2010. Now you can see number of physiotherapists practicing IFT, short wave diathermy, TENS, IR, traction, laser, ultrasound, electrical stimulation, hot packs and cold packs. तो आप देखो कि how many people are they are still following the this one electrotherapy modalities. अब उनको कितना पता है एविडेंस के बारे में, I don't know, but this is what the study has shown us. Now continue the same next page. This is the reported types of exercises. What exercises are beneficial for low back pain जो इंडिया में यूज होती है for low back pain? That is, you can see lumbar stabilization, back exercises, core stability, static and dynamic back exercises, McKenzie, back strengthening exercises, Carrington Campbell exercises, bridging exercises, stretching and abdominal exercises. Now if you see the highest people are using lumbar strengthening. वो समझते हैं कि अगर हमने back pain में lumbar को strengthen किया तो pain चला जाएगा. So but we have to have the evidence. Is back strengthening exercises or lumbar strengthening क्या ये effective है कि नहीं है, that evidence. So this is the ये Indian scenario है कि हम उसमें क्या use करते हैं exercise में, electrotherapy में. So I wanted to show this. Now there was a systematic review done by Josha R. Zedro et al. In 2019. ये एक systematic review हुआ था. इसका aim था of this review was to determine what percentage of physical therapy treatment choices for muscular conditions agree with management recommendation in evidence-based guidelines. कितने लोग, कितना percentage of people are still using some evidence in treating muscular conditions? उसमें कोई भी condition आ सकता है. So they wanted to know that how many percentage of people are using evidence-based practice when they are treating musculoskeletal conditions. Now there are something called as non-recommended treatment and treatment with no recommendation. Not recommended treatments include physical therapy treatments not recommended in guidelines or found to be ineffective in recent systematic reviews. अब कुछ reviews में हमने देखा कि कुछ techniques are not effective in particular conditions, and in second में they include physical therapy treatments where guideline recommendation and evidence from systematic reviews was inconclusive or where treatment has not been investigated in a systematic review. इसमें दो चीजें हैं. इसमें हमने देखा कि जो treatment आप कर रहे हो, the treatment you are giving, whether it was recommended as per guidelines or not as per systematic reviews. And second में we chose physical therapy treatments where guidelines recommendations from the systematic reviews was inconclusive, कि हमें evidence नहीं मिला कि whether it is whether recommended है कि नहीं recommended है. This is a study done by Josha, and उसमें the conclusion was many physical therapists seem not to follow evidence-based guidelines when managing muscular conditions. There is a considerable scope to increase use of recommended treatments and reduce use of treatment that are not recommended. तो इन्होंने चेक किया था इस रिव्यू में कि कितने लोग एविडेंस बेस्ड प्रैक्टिस फॉलो करते हैं और कितने नहीं करते हैं. But what they found, most of the therapists do not use evidence based practice when they are practicing in their own clinics. So that is very important. One of paper. Now अब आपको मैं एक सवाल पूछता हूँ, डॉक्टर सौरभ, am I audible to everyone?
Yes, yes, sir.
Yes, sir. Please go ahead.
Can you hear me? Yeah. Okay. So I want to ask. You can message in chat box. अब मुझे बताइए, ये एक पेपर मैं आपको दिखाने वाला हूँ, रिसर्च क्लियर्स मिथ्स वर्सेस रियलिटी। आप मुझे बताइए, आप में से कितने लोग ये समझते हैं कि फॉरवर्ड नेक पोस्चर करने से सर्वाइकल होता है और नेक पेन होता है? कैन आई गेट डॉक्टर, कैन आई गेट इन डू यू हैव, या चैट, यू कैन आंसर इन चैट बॉक्स कि हाउ मेनी ऑफ यू थिंक दैट, अगर हम कितने लोग पेशेंट्स को बोलते हैं इन इंडिया दैट सर मोबाइल पे ज्यादा मत खेलना, गर्दन में झुकाना मत, पेन हो जाएगा? How many of people are there who are supporting? Can I get some answers in the chat box? कि कितने लोग ये बोलते हैं पेशेंट्स को कि if there is any relationship between the forward head posture or cervical posture with cervicalgia? So yeah, okay, I'll talk in English, Dr. Safia. I'm asking that how many of us normally tell to the patient that please do not do forward neck posture, don't bend your neck. If you bend your neck, you are going to have cervical pain. So this is what, because you are using a mobile cell phone. So I got answers in chat box कि बहुत सारे लोग ऐसा कहते हैं. Many people tell that. Now I will show one paper. There was a paper published in Australia. If you know the Peter O'Sullivan sir, he is a very well-known research scientist from University of Curtin. उन्होंने एक पेपर किया था उनके बच्चों ने, वहां पर उन्होंने यूसी पेपर इसकी टाइटल था neck posture clusters and their association with biopsychosocial factors and neck pain in Australian adolescents. So normally this time adolescent people who are young, 15 to 18 or 12 to 18 years of age, they are fond of playing PUBG, right? And the mobile games. So they want to see that whether this playing PUBG in sagittal axis, whether it is having any association with neck pain or not. तो उन्होंने किया. Now the background of study जो आप देख रहे हो यहाँ पर, it clearly shows that there is conflicting evidence on the association between the sagittal neck posture and neck pain. The objective of study was to determine the existence of clusters of neck posture in a cohort of 17-year-old and to establish whether identified subgroups were associated with biopsychosocial factors of neck pain or not. मतलब क्या कुछ होता भी नहीं है. तो इन्होंने एक स्टडी किया 7 ओर्स पे. इट इज अ कोहॉर्ट, दैट मींस उस पे फॉलो भी किया गया, एंड दे वांट टू सी दैट वेदर दिस इट इज रियली, सो इट वाज अ क्रॉस स्टडी. नाउ आई विल शो यू the conclusion of study. Now if you can see this, yeah, the conclusion is showing the meaningful sagittal stiff neck postures clusters were identified in 17-year-old, and the findings of no association between the cluster membership and neck pain and headaches challenges widely held beliefs about the role of posture in adolescent neck pain. So they were not able to find much of relationship between the forward head neck posture and neck pain, because आपको पता होगा, you might know that pain, it is following biopsychosocial model rather than a biomedical model. पहले we used to call it biomechanical model. Biomechanical model also is not effective right now. It's because only we are following a biopsychosocial model of pain. Now this is about neck pain. Now I will show you something else. Now this is the best evidence which is available with us for low back pain. Now there are some, I will show you some. मैं बहुत ही fast जाऊँगा, I'll go very fast. See, there is a paper published by Nuri 2019. They showed that ultrasound, there's a lack of evidence for use of ultrasound in low back pain. Kinesiotape, there is no significant effect. There is lack of evidence of use of kinesiotape. How many कितने therapists आप में से हैं? How many therapists who are using K-tape for low back pain? Without evidence, we don't know, because these are all meta-analysis. Highest evidence we have available. Now, then we have TENS. TENS we have. TENS is not recommended for use for low back pain. We cannot use it because we don't have evidence available. Same way, now PNE, the neuroscience education, there is a moderate evidence available that we can use this that educate patients. देखो हम लोग क्या पहले बोलते थे, used to tell that if you move अगर आप आगे forward posture करेंगे, हम बोलते हैं if somebody comes to you with back pain, what we tell him कि आगे नहीं झुकना, don't bend forward, इसमें डिस्क चले जाएगी पीछे. No, nothing like that. So University of Curtin did some studies where they showed us that forward bending or backward bending, side bending, it doesn't have any role with low back pain. So we have the evidence right now. Now, massage is not recommended for low back pain. Osteopathic intervention, it is also not recommended for due to lack of evidence. Osteopathy, कितने लोग करते हैं आजकल? How many you do osteopathy, but it is not recommended for the. So there are papers I can share later. Now, there is one more. Now, spinal management. This is physiotherapy. Now, meta-analysis shows that we have moderate evidence that spinal manipulative therapy can provide better results than other interventions. That's very important. Now, so this is some evidence I want to share with you. Now, aerobic exercises for the low back pain, moderate quality evidence we have. Then movement control exercise therapy, very low to moderate quality evidence we have for low back pain. Back school, because of the low quality of evidence, back school are not recommended for low back pain. Before 10 years, हम बोलते हैं back school, but now it is absolute. We are using it. We are not using it anymore. Okay, so this is something. Yeah. Now, what is important that I had asked my seniors that what hurdles we have in India, why we don't get quality research from Indian subcontinent. There are some problems in India. I'll tell you why. Specialty clinics in Indian college, OPDs, hospitals, OPD like back screening. Now, आप मुझे बताइए, I can ask you in chat box, how many hospitals have back clinics? Can you answer me in chat box? How many of us have back clinics in hospital or hospitals? जहाँ पर हम लिखते हैं कि today we have back clinic and a physiotherapist will be there to assess patients, or a neck clinic we have. How many clinics we have? We don't have. I think very less we have. Fall clinics. We have some fall scales for adult and 100 scale for pediatric scales. So we should have now balance clinics, fall clinics, back clinics, neck clinics we should have, because उसमें क्या होगा, when you are working with some senior therapist, he will tell you that is back condition में how much evidence is available with us. So that is it is lacking in India. India में क्यों lacking है? Because हमने कभी इस पे काम ही नहीं किया. We have never worked on that. Because we are lacking these kind of special clinics, so that जो हमारे interns आते हैं, they should understand कि मुझे पढ़ना क्या है. If an intern, when he finishes BPT, if he is posted in back clinic for 2 months, and he has a good reputed faculty who will teach him that regarding myths of back pain and the facts of back pain. So it is going to have a very good effect on his career when he does masters, or if he goes in research or does his PhD. It's very important for him. So we are lacking this. Now, support for those from the physical therapist, referral services, and management and healthcare team. Now, many of us, they lack support from the physical therapists. They will tell them that ये ultrasound करना है या ये exercise करना है, but they will not teach them what is clinical reasoning and whether the ultrasound is effective or not. उन्हें पता ही नहीं होता है. So what they will teach? So it's very important for them to teach that. Now, referral services in India, the more important problem क्या होता है कि the orthopedic surgeons will refer a patient to a physiotherapy clinic or neurosurgeon. They will refer, but they will write कि इसको back exercise देना है और ultrasound देना है. But now the problem, देखो problem कहाँ पर है? Problem हम में है. If I am there, if I am a research oriented person, मेरे पास evidence है, I will tell my doctor that sir, with due respect, this ultrasound is not effective in low back pain. I have the evidence with me. So he will, उसको लगेगा कि भाई कुछ क्या उसने बोला, what he has told. Sir, okay, he will write tens. He will say, sir, tens also is not recommended. Sir, you don't have evidence. Then next time, before referring your patient, he will tell you, okay, I am referring the patient to you. You can independently. That's very important. See, यहाँ पर ऐसा बहुत time पे नहीं होता है. But we have developed this career because when I talk to my consultants, they know that he is going to rebut me with evidence. It's very important. Now, culture of patients taught and made to understand about what it means to be in a trial, informed consent or risk and benefit. It's very important that when a patient comes to you, he should be taught that what therapist is telling him, and therapist इसकी responsibility बनती है कि आप उसे पूरा consent लो कि I am going to treat your back. This is the technique I am going to use. I have the evidence available with me. So because आजकल का दौर जो है, patient knows much better than us. वो पहले से आते हैं रिसर्च करके PubMed पे कि बैक पेन में क्या है, एंड थेरेपिस्ट को पता नहीं होता कि ये क्या बोल रहा है? So it happens many times. You feel embarrassed because therapist, patient, you always think that patient is well informed, वो well educated है, and we have to be one step ahead of patient. Why? Because that is will be having more respect for you. If you are less informed, then you will be embarrassed in between that. Now, other problem is that good mentorship from faculty with expertise in trial and statistics. Now, it's very important in a college or a university that your mentor should be good. You should have a mentor like Arunachalam sir. Arunachalam sir is a unique mentor who definitely encourages everyone to learn something, and you learn. Even मैं भी sir का student, I learned from him that sir, please teach me these things. So you have to always have good mentor. It's very important that mentor should be very good in research. तभी वो आगे उसको distribute कर पाएगा knowledge. Now then there is something called as monitoring and incentives for good research. Now you should be always monitoring what are the incentives I'll be getting in a research team. I mean, see, the good research which is valuable for patients. When you are monitoring, that particular technique is very effective in this technique, and also it is going to have very good incentives. Why? Because when you are with research, it changes your whole perspective of clinical care. So ये चीजें हैं जो कि hurdles थे for research in India, which some of the things are there. Now, what are the prerequisites for a prosperous researcher in physical therapy profession? Now, it's also very important. Why? Because you should understand a good researcher must be open-minded, and it should must also adopt a critical way of thinking. सबसे important researcher क्या होना चाहिए? It should be open-minded. अगर मैं researcher हूँ, if somebody tells me that sir आपकी technique is wrong, I should be able to accept that. Okay, I should be. You should always accept your faults and your drawbacks. अगर आपने वो accept नहीं किया, then you will never be a good therapist. Because why? आप समझते हो कि मैं ही सब कुछ हूँ. I am everything. No. In research, we tell that it's a learning phase. Every one of us is learning. We are learning something new. And always you have to be humble. You have to be down to earth and be open-minded for criticism and for appraisal. It's very important. Now, besides, he or she should be hardworking, diligent, focused, and devoted to his or her specific field of interest. अगर आप ऑर्थो में काम कर रहे हो, don't try to go to neuro. It's not your field. If you are done masters in neuro or ortho, be stick to your field, because that is the हमारे में कहावत होती है. I am sorry if I tell in Hindi. जैसे कहावत थी कि दो किश्ती पे पावर होगी ना, तो कभी आपको मंजिल नहीं मिलेगी. So you have to be focused on one particular field, that this is my area of interest and I'm going to focus in this direction. So that will definitely help you become a prosperous researcher. Now, updating his or her knowledge is of utmost importance and can be accomplished in several ways, such as following the current literature. It's very important, attending conferences or exchanging ideas with colleagues working in relevant field. You have to be very important that you should always be accustomed with the current literature. कि आज 2020 चल रहा है, what literature is available with us, federal evidence which we have. I shared with you of low back pain or a neck one surgery. So you should have much literature, that what is the best available literature available right now. Furthermore, a modern researcher must be resourceful and inventive in order to transform his or her scientific queries and hypotheses into a realizable goal. It's very important that a therapist, he should be resourceful. He should have all the resources, that he should always try to engage with professors and researchers, that he can transform his ideas into queries, and the query leads to hypothesis testing, and ultimately he can publish his research. That's very important. Now, there is something called as clinical research benefits for a physiotherapy professional. सबसे important क्या होता है? It can contribute to the body of knowledge. If you are doing some good clinical research, it contributes to that is be called as you are giving something to literature. If somebody in India, I told you that research, we are, as sir told you, Rajam sir told you, we don't have a single journal from India which is internationally acclaimed. Only we have one journal, that is from Yanagoya College, and that is also multi-income. But for physiotherapy professional, अभी तक एक भी journal हमारे पास नहीं है, I say, or which is having high quality evidence. That is because we are lacking. Now, to become a recognized expert in the field, clinical research, when you are doing research, you will be a very well-known figure in the field when you are doing research, and it can add to your fame, your name. To help develop or improve on existing practice or policy. You can help if you are doing a good research. It can help to improve or develop a good existing practice or policies, and you can tell them that no, this technique is much effective than the technique, so they can revise the guidelines and practice guidelines. To advance your career, promotions. This has happened with all of us. जो stature या जो person I am having right now, it was not there when I didn't have clinical research. So it has changed. You get promotions, they see your work, you involve your HODs, your medical directors, your many doctors, so they see your work. And it's very important that you can get promotions when you are having research with you. And the very important aspect that is called as gain in inner satisfaction. जब आपका नाम आता है ना PubMed में या Google Scholar में, you will feel very satisfied. अब मैंने कुछ किया, I've done something very fantastic. So it gives you a very good inner satisfaction. Then there is one more point that is called as new learning and earning opportunities. Now, right now, if you know that when you are part of a project, you get funding from university and you get funding from different companies who want to test their equipment or a particular technique. So you have learning opportunities, you have earning opportunities. It's very important. Research is not dry. It has a lot of things that, but it needs perseverance. It needs that you should be dedicated enough to pursue that career. Then you can be part of scientific team, writing, and part of funded projects. It's very important. आपको पता है, I have a study, 2-3 studies we are doing here. We have authors from 7 countries of the world. We have authors from Malaysia, we are from Canada, from Egypt, from Oman, because they are part of our study. They are doing all the thing, contributing to the study. So you can be a part of multidisciplinary team, and people will know that. So it's only possible when you are part of scientific team. Then, now there is something I want to share you. Yeah, okay. Just a moment. Yeah. Now, case report of novel intervention is useful tool to introduce new technique. Now, हम लोग क्या बोलते हैं कि भाई case study is the lowest part of the literature, but it's very important. अगर आपको start करना है अपना career, you can go with case study. Go with case report of one condition. कि आप ये बोलोगे सर मैंने I have treated this patient of knee pain or any tenderness of knee joint, and I found this technique is very effective. Go with one case study and try to publish in a good journal. So that will give you a new tool that you are going to tell that this technique was very effective with us, and I'm going to have this kind of evidence. Now, if he or she is appointed in a university, first is salary, second is perks, and for every research published from the university, collaboration with other researchers to enrich research experiences. If you are appointed in a university, first thing is your salary is determined how much H index kitna hai. As I sir told you, Arunachalam sir told you in the last presentation, that H index is very important when you are having your research career is good. So you get good salary, you get perks from university for every research you publish. It's very important. In Middle East, you get it. Moreover, a researcher can also apply for grants from external agencies. Sometimes, if your university is not funding you, you can get grants from other sources. They are ready to pay you grants when you are going to do a good study. Now, collaboration with a medical equipment company to validate their equipment. Sometimes a company comes to you, or you can approach that, sir, your machine. Sometimes they will always tell you that my machine is the best. I am best in the market. But you can tell them that, okay, I am going to validate your equipment. I am charging you 5 lakhs, 10 lakhs. So that is going to also help your research career when you are going to collaborate with some company to see that the equipment is effective or not. Now, also validation would include reliability and validity. So you are going to check the reliability and validity of the equipment if you are trying to be with some company or with some association. Now, companies offer attractive compensation for such researchers. They will definitely give you if you are doing their quality study for them. Now, what are the what editors look for your work? Now, if you are doing some good quality researchers, the editors of journals and where you are submitting your work, they will see the quality of evidence, whether your quality has good science and well planned and well executed study. Then what is the significance of your study? It's very important whether you are going to add to that literature, whether your work is consistent with the scope of journal, demonstrated broad interest to readership, whether your area of work जो आपने काम किया है is going to help the readers of this area of physical therapy or not? Will it be cited? Well-written story and author enthusiasm. These are all things that these the editors see when you are trying to give them something from your side. Okay, then these are my references which I have shown. I think I have come to conclude because I didn't want to take much time, because the talk is very important, that why you want to do research, and I gave you some idea of the clinical research, and this is and yeah, and now as I told you that we have started a platform for Indian physios, clinical research platform, where Arunachalam sir is our vice president and also the faculty. So we have a team of 21 professors around and clinical research around 7 countries of the world who are teaching. And our members enjoy numerous benefits from learning from veterans, research publication, assistance to mentorship. And membership is just for 3 years with a meager amount of 3,000 rupees we are charging. It's just a meager amount, and they're eligible for all the benefits and use of suffix mikra of the name. So this is just nutshell of our association. Why we chose, because we want to contribute to the fraternity, and we started this platform for you all. And right now we are about to finish our course of 2 months. It took 2 months, and for 2 days we are going to finish it. Then you're all most welcome to join ICRA and to learn from veterans, to understand about the clinical aspects of clinical research. Is very important for you guys. So you're always welcome to learn from us. And that is, I think I have come to the conclusion of my talk. Thank you so much. For any queries, you can contact my PRO and treasurer, Dr. Vipul Sharma. And this is our email ID and website. You can use it. And that, I think that's all from my side. I think I'm not taking much of your time. So thank you so much, guys. If any queries, you can ask me.
Thank you, sir. Thank you so much for amazing presentation. It was knowledge packed. I know the time is really less, but it was really wonderful. Participants, you can ask your questions.
Yeah, you can
I think there was a question. Yeah, you can unmute yourself and ask questions. Dr. Abhishek Sharma. Abhishek sir, you had some question.
Yes, sir. Yes, sir. Good
Yeah,
evening,
please.
sir. Sir, actually, I want to ask, in RCTs, we need ethical approval as from any RCT. But for systematic reviews or narrative reviews, is there any need for ethical approval or any kind of approval we need to submit?
No, you don't need. It's only if you are using intervention studies like RCTs or even case study. I will I can show you one paper of mine. We are doing a paper, the wonderful paper of clinical orthopedics, where we had a boy with 14-year-old paraplegia and also the infected wounds. So it was managed by us by multidisciplinary team. So in that cases, you need ethical approval, because it's always very good. You can submit your ethical approval to CTRI, get it registered, so that they understand that what work has been done. So I will urge Dr. Abhishek Sharma and every one of you. You are veterans and very famous person in India. So please, sir, try to contribute this to your students so that they understand the importance of clinical research, which was lacking. And I'm happy that people are now understanding it in India.
Okay, sir. Thank you, sir. Thank you for the answer.
Thanks.
Any other participants? Any other among participants?
Hello.
I think more than doubts, you are getting praises, sir.
Hello.
Yeah,
Am
Nick.
I audible, sir?
Yeah. Please go ahead.
Good evening, sir. Sir, I wanted to ask you, practically it is very time consuming to critically appraise an article. And after doing such lot of things, and then we have to apply the conclusion or evidence to our practice. So any tips to go for a less time to critically appraise and apply the results on our treatment in physiotherapy?
Yeah. So Nikita, what is your area of interest? Are you working in neuro or ortho?
MPT ortho. MPT ortho.
See, I'll tell you one thing. The most important thing is that when we get a paper, we just read the result and conclusion or the title of study. So what I will suggest you all, that if you have evidence with you available, try to first learn that about that. See, there are evidences sometimes it supports particular technique. Some evidence which are contradictory. It will tell that no, ये technique effective है, ये effective नहीं है. So you have to use your reasoning See, I showed you some on low back pain. I showed you evidences. आपको मैंने बताया कि लो बैक पेन में आपको बोलेगा कि टेनिस इज इफेक्टिव इन लो बैक पेन. यू कैन टेल हिम सर इट्स नॉट इफेक्टिव. सो यू हैव टू यूज द एविडेंस अवेलेबल, जो हाईएस्ट एविडेंस है मेटा एनालिसिस. यू हैव टू सी दैट व्हाट टेक्निक वो किस पे किया गया. एंड नाउ इन इंडियन सिनेरियो, if therapists are using this evidence based practice in their scenario, the results है, so it will be a very good effect. जो आप इसमें दो पॉइंट है इसमें. अगर आपने पेशेंट को पहले कहा है कि सर ऐसे करने से पेन बढ़ेगा, अब कल आप उसको बोल रहे हो कि नहीं ऐसे करने से पेन नहीं बढ़ेगा, तो वो बोले क्या हो रहा है इसको, मतलब why he is telling me some things. So you have to understand it's always better for a particular condition. उसके बारे में पहले आप थोड़ा सा सर्च करो कि इस टेक्निक में what is the good evidence available with us. So इसमें क्या होगा, इसमें ये होगा कि जब आप पेशेंट को ट्रीट करते हो, that time you have the evidence with you so that you can do something very good to the patient without that any embarrassment. So this technique, for example, I told you that we have now the best part is that we have available literature in federal evidence we have. So now you can get an insight. अगर आप कोई technique, if you are treating neck pain, you know that this technique is effective in neck pain, so you can use that. अगर उसमें आपको लग रहा है कि something is not good or you are feeling that, you can publish that paper. आप उसको publish कर सकते हो कि नहीं, I have done my study on my patients, I found that this technique is not effective. So you can rebut that. That is the beauty of research, clinical research. So it is having two effects. एक या तो आप support करोगे या उसको you will reject it. So it depends on your clinical reasoning, what you want from the literature.
Thank you, sir. Thank you.
There is a very good question for you, sir.
Yeah.
Question by Dr. Vijay. What all the strategies we need to adopt for transforming the evidence-based practice into our clinical practice?
See, first of all, any hospital जहाँ पर आप काम करते हो, you should always see that it has an ethical committee और वहाँ पर एक culture है research का. If there is no culture of research, how you are going to have good effect? You should always work in that center. Or see, I went to in India. When I came, I went to many universities. उनके पास अभी तक ethical committee नहीं है उनके पास. So you have to work in that scenarios where you can work. And जो आपके पास guidelines हैं, see how we work. हमारे पास जो evidence available था, हमने ये किया कि हमने अपने doctors को बिठाया, हमारी team है, department. We told them, see, if you are sending a patient of cervicalgia, this prolapse or any condition, see, this is the evidence available with me. So don't try to write something which is not effective for this patient. So now what is there? We have some guidelines that is called as policy procedure guideline. We have PPGs. Now a doctor, nobody refers patient to, he doesn't write kya karna hai. We have this kind of independent practice where I am the best person to judge. अब अगर मुझे knowledge नहीं है, what I'm going to practice? I should, before of that, I should know the evidence-based practice guidelines की इस condition में कौन सा best evidence मेरे पास available है, and that I can incorporate in my practice. Because I told you that we have many hurdles in India. जब तक ये hurdles दूर नहीं करेंगे, and you have to start at your, see, don't look at all India. आप काम करो अपने hospital में. अगर आपने अपने hospital को change कर दिया, that means आपने एक समाज चला दी है. So that is very effective. जो आपके पास, if you have some juniors working under you, if you are teaching them, so that is going to help them in their career. Because, but for that, you should know first the guideline. कि आपके पास, do you really know about these conditions? You see, today जो मैंने paper आपको share किया आज from Australia, how many of you knew this paper of neck pain, cervical axis of neck pain and neck pain? Many people did know, I think so. कि mobile से ऐसे करने से neck pain बढ़ेगा. But we have the evidence, it is not causing any neck pain. So you should have the evidence available with you.
Okay, it was a wonderful presentation by you, sir. Of course, as I told, the time was really less for both of you. And thanks to both of you from My Rehab Academy. And
So
ICRA will be our learning partner for very, very long time. This is how we at MRA wish. And I will take some more liberty to give a heartfelt thanks to my CEO, who actually devised this idea to bring the research in our platform. And apart from that, Dr. Diwakar, who is the financial instrument behind our My Rehab Academy. And of course, Dr. Sumanjit Sharma, CEO, sir. I have already extended my thanks. And then Dr. Kalim, who is actually calling Arunachalam sir and taking a lot of effort of organizing the event. So it was a wonderful event, and thanks all the participants, because you see, hardly 5 or 7% of participants would have moved from here to there. Why? And it shows that the kind of quality and the quantity you guys have delivered. I mean, you have done excellent.
No, actually, Dr. Saurav, this is because of our Guru Arunachalam sir, because I know he's very famous in India. He's our, I call him a superstar. He's Rajnikant of our fraternity. That's why
He's an encyclopedia.
Arunachalam sir,
the video, sir.
the two lines from you, sir.
2 lines.
2 lines from you, sir.
Yeah, Corona has taught us how to cut our hair, how to use computers, and how to establish relationship also. In this Corona period, I have got some fantastic friends and fantastic contacts, and how to educate research also to people. Now, this period has brought everyone closer to each other. So until now, until this Corona period, we all were not known to each. I was known to Sidiq sir before, but about My Rehab Academy, EXRX India, all these people are doing fantastic job. Even I didn't know that. So now we are all part of it, and I am also a scientific advisor to My Rehab Academy. I am so delighted to be part of. I am so happy that both my hands are together today.
Yeah, wonderful communication today, and I hope this platform will carry on a lot of research things for India, and it will open up the doors for, because I see a lot of students today has shown interest, and you'll be surprised to know that we have got a lot of like messages on the Facebook also. We are getting messages on the Facebook like, I'm the student, can I join? I'm the student, what can I do for the research? I mean, this is something is really the kind of moment which is memorable, that the new guys are willing to join. I remember when I passed about 11 years before my bachelor, or could be now 12 years. I think Corona 6 months, it looks like the year has gone 0. Oh yeah, 12 years. So that time I wanted to get into research, and Diwakar is associated with me since very, very long time, right? Since my student time, he knows that. And we did not get, let me tell you, forget about physiotherapy, we did not even get to inform like how can we get into the area of research. And today when we are having a platform where we are bringing the giants like you guys, who are opening the doors of the research in the country for the physical medicine, is something out of my words. I can express the respect to both of you.
So
Thanks.
over to Diwakar.
Thank you. Thank you, Arunachalam sir and Siddiqui sir. Thank you. So nice class, and we didn't expect that much, like 350 and 400 candidate will come, and full seat continuously for another like first half an hour is so like how to maintain and how to coordinate. So I really liked it. Thank you so much, and all your presence is like that helped us a lot. Thank you, sir. Thank you.
So over to
And
Kalim.
any students? Yeah, Kalimullah sir.
Over to
I
Dr.
think he's
Kalim.
not there. Yeah. Our CEO sir, please come.
Yeah, thank you, sir. Yeah. So thank you, sir. Thank you, Arunachalam sir. Thank you, Sidiqui sir. So it was a very much helpful for all the physios of India. So whoever, at least 400 people have joined through Facebook and Zoom. So it was a very, very helpful for everyone.
A small word from my side. Please take Dr. Mohammad Sidiq. Today you made the evidence-based practice in such a you elaborated in such a nice way and lucid way that I don't want to take the name, but many people, they keep insulting the juniors. I think Arunachalam sir will agree with me because he's into the teaching field. They keep insulting the juniors and associates. Okay, this is not evidence-based practice, so you are not supposed to do. So you illustrated in such a lucid manner that definitely now anybody can fit everything in this 5 points, right? From apply to assess. sorry, asked to assess.
True. You are right. This is a correct point, sir. Because whenever we are delivering something, whenever we are trying to correct somebody, we should correct it in a correct way. We should not be in a harsh tone. We should not use these people, the words like these people, rubbish, stupid, nonsense. All these things are not positive words to correct someone. If you tell this thing you are doing in a correct way, they will change. Otherwise, if you tell someone that in this negative manner, they will take the ego and they will start fighting with you. Whatever you wanted to tell, that will not reach out. Correctly, Sauravji, you have said the correct way. Communication, the tone of communication is very
Thank you,
essential.
sir. Thank you, sir.
And
Yeah, nice.
Sidiq sir is very expert in communicating things.
I
Yes.
buy that. Definitely. He's definitely
Thank you for
very,
your kind words, sir. Actually, sir, the thing is, I'm learning from Arunachalam sir only. That's why.
No. That is his.
sir.
He's
Sir, I will post the feedback
Yeah.
link.
Anybody from candidate who want to thanks our
Want to thank, sir. You can
person,
unmute
please
yourself.
come and please thanks him.
Dr. Saurabh, I have to go because there's a patient waiting for me on call. So thank you so much
Please,
for
sir.
your
Thank you
call.
so much, sir. No
And
problem.
I hope that
Please.
you had a great time. Arunachalam sir, bye bye, and Dr. Diwakar and everyone of
Thank you.
team.
Thank you, sir.
Sure,
Thank you
sir.
so much, and I hope
Thank
to
you
see you
so
soon.
much.
Bye bye.
welcome.
Feedback link will be posted in the group. I request everyone to
Yeah.
give their feedback link. Yes,
It
yes,
will
Dr.
share through
Ankit. This will be
it will
posted
share
in the
through
group
email
as well as
also.
here.
Yeah.
Yes, and kindly share your the feedback. So now with with your permission, Dr. Arunachalam sir, can we wind up for the today's event?
Yeah, thank you.
Yeah.
Yeah,
Thank
see
you,
you, sir.
everyone. Thank you.
I'm winding up today's event, sir.
Thank you,
Thank you.
sir. Thank you, sir.
Yeah, thank you. Thanks, Dev.
Thank you, Sumanji. Thank you, Kalimullah.
Thank you, sir. Thanks a lot.
Thank
It
you.
was,
Thank you.
it was a very
I
much helpful.
didn't suddenly your name I forgot. I was the CEO was there.
This is
I'm
Suman.
sorry for that.
This will be Suman, sir. I am here
Yeah,
like
Sumanji, no,
Suman.
I won't
Please.
mention your name as Suman. I'll use this G, Sumanji.
Anything, sir.
because Kalim sir was your junior.
Yeah. His name will come.
And I am junior to Kalim sir. So it is like a you can tell me Suman sir.
Yeah, Kalim's name I will not forget even in my dream, in my sleep also.
Okay, sir.
I should thank
Thank you,
Kalim for getting me into your team. Yeah, thank you. Kalim.
Thanks a lot. Thanks a lot, sir.
Thank you, sir.
Thanks a lot.
Nice time. Thank you.
Bye.